What health crisis faced Holocaust survivors after liberation? Imagine stepping out of a nightmare and into a world that still feels unfamiliar and harsh. After liberation from Nazi concentration camps, survivors faced a health crisis that was just as overwhelming as their ordeal in the camps. Many were severely malnourished and starved for months or even years. Their bodies had been drained of essential nutrients, leaving them weak and vulnerable to illnesses. Diseases like typhus and tuberculosis spread rapidly because of the filthy and crowded conditions in the camps. Survivors often arrived in critical condition, with some barely able to move or breathe properly. One of the most dangerous issues after liberation was refeeding syndrome. When survivors who had been starving suddenly received high-calorie food, their bodies could not handle the sudden shift. This caused serious problems like heart failure and immune system collapse, leading to many deaths within days. For example, at Bergen-Belsen, over 30% of prisoners died shortly after liberation, partly because of these medical complications. Long-term health problems also became common. Survivors often suffered from osteoporosis, which made their bones fragile and prone to fractures. Many had gastrointestinal problems like chronic diarrhea or stomach pain. Some developed tumors or other long-lasting health issues due to their weakened immune systems. Women faced reproductive health problems, including irregular menstrual cycles and complications related to childbirth. The psychological toll was equally heavy. Many survivors experienced post-traumatic stress disorder with flashbacks, anxiety, and depression. The trauma of their experiences lingered long after they left the camps, affecting their mental health for years. After liberation, providing medical care was a huge challenge. Displaced persons camps were set up by Allied forces and Jewish organizations, but resources were often limited. Medical supplies, proper nutrition, and mental health support were hard to come by. Many survivors continued to suffer from infections, malnutrition, and emotional scars. Their recovery required ongoing medical attention and social support, which was not always immediately available. In summary, the health crisis faced by Holocaust survivors after liberation was complex and severe. It involved immediate threats like starvation, infectious diseases, and refeeding syndrome, as well as long-term issues such as osteoporosis, gastrointestinal problems, and mental health struggles. Their journey to recovery was not just about physical healing but also about overcoming the deep scars left by their experiences.